Hey, Adam,
Geez,
one
why,
thing.
why do you think they called bumpers, Gary?
I don't know.
Because they come at the beginning, at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed 2 little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud and subscribe today. Now it's time to get started with Sweet Talk.
Good morning, everybody, and welcome to Sweet Talk, ISU's Continuing Education and Workforce Training's weekly podcast. We have some really wonderful guests with us today, but as you can see, our normal host, main host, Paul, is out. We have with us Shirley Hockett in our office, who is the office manager extraordinaire, as well as our interim director, Raelyn. How are you doing, Raelyn?
Doing well today. It's great to be here on this podcast. I'm actually really excited about this one. This is a project that we've been collaborating on for quite a long time. So it's great to see it come to fruition. So we have Paul and Karen Beattie, Darin Jernigan, and Darren Hearn with us on this podcast. And I'm just going to maybe start with Darin Jernigan and have him introduce himself, and then he can introduce his cohorts in crime.
Thanks, Raelyn. My name is Darin Jernigan, and I am a longtime faculty member at Idaho State University, and I work closely with everybody on the SWEET team. But I'm also associated with the Wilderness Physical Therapy Educators. And we are a group of physical therapists that have been developing a curriculum to teach physical therapists about how to perform physical therapy in austere environments. And I just want to pass the baton. I'll have my colleagues jump in and give a little bit of background information. And we'll start with Paul and Karen Beattie.
And thanks, Angie and Raelyn and Shirley, for the opportunity to be here with you guys. It's a real honor and a privilege for us to be working with you. We're real excited about the pathway as we're going down. Let me get up a little closer so you get a better sound here. Again, my name's Paul Beattie, and this is Karen, my wife, Karen. And I am a professor emeritus at the University of South Carolina. And professor emeritus basically means that you're an old person that's been there for a long time and you can still feel important, but you don't really have to do anything. So over the last 3 or 4 years, I've had the opportunity to meet DJ and Darren, Karen, and many other folks that have been with us. And we've had this incredible opportunity to combine our skills and our life experience, and most importantly, our passion toward working with patients and with people in the backcountry using our physical therapy skills. And to give you a brief overview, and then I'll turn it over to DH, we got together as a group after a paper I wrote that came out in the National Journal. Some people came in and we started talking on the phone. It was one of those deals where DJ called me up, and we had never met each other. And after about 15 minutes, we were like close bosom buddies and best friends, and have been that way ever since. It's a remarkable story. I just love that kind of stuff and that kind of vibe. And we started to combine our interests. And again, met with other folks who brought in backgrounds from the military PTN for Darren Hearn, whom you'll speak with shortly, from a rescue ranger perspective, from DJ, from Darren, and many other areas. And we wanted to share this information. We're all professors and have a scholarly background. They're used to writing papers and doing talks and stuff like that. But this was something different, and this was something new and exciting. And so we got together, we formed an organization, and then we hit the jackpot when we had the opportunity to work with you folks at ISU. And all of a sudden, all these dreams, that we had just kind of talked about on Zoom calls and phones were a reality. And now we're in a situation where we have created continuing education courses that are looking to be really exciting and will be offered online through CEWT, and also working with the potential to do some on-site programs in which we bring people from around the country who share our passion to come and join us, probably in Pocatello this year, to get out and spend some time out in the backcountry and learn our skills and have a lot of fellowship and a lot of interaction. And so that's kind of where we're going. Let me turn it over to Karen so I don't hog the whole thing here.
Hi, everyone. We're certainly glad to be here. We're tuning in from the East Coast, Columbia, South Carolina. We just returned from Pocatello maybe about 6 months ago from the great annual emergency medicine conference there. I think that's our third or fourth time there, and it's just a real joy to go to Pocatello all the time, as often as we can. So thanks for having us. So I'm also a physical therapist, and I'm not a wilderness EMT as the other guys are. I'm a wilderness first responder, and I've combined my PT and wilderness first responder skills, and I'm also a yoga teacher. And bringing that into this wilderness physical therapy educators to really use our skills and follow our passion to take our practice outside. And it's great. I love being kind of on the outside of being the yoga instructor, because I think it brings an important aspect into wilderness medicine, and that's that we have to be mindful all the time of the situation when we're out there, because we have absolutely no control of the environment when we're practicing in austere environments. And so again, referencing the yoga, that every time we practice yoga, and as we try to practice on our mats, but also throughout our daily life, we're reminded to be present. And when we are present, then we can, take care of us, but then be better able to take care of others and to be able to adapt in the moment, which is so essential in wilderness medicine. So I just wanted to introduce myself and say that's where kind of my tangent and helpful onto this team. And I think Darren and DJ need further introductions. Darren's got a legendary climbing history and Grand Teton Ranger, backcountry Jenny Lake Ranger curricula vitae. And Darren Hearn, maybe we'll go to Darren Hearn next, and then come back to DJ and let him wrap up our skill set with this team.
Hey, Karen, thank you. This is Darren Hearn. I'm really excited to be part of this team and doing what we're doing and bringing physical therapy to the wilderness. So my background has been as a physical therapist in the military for I guess a lot of years. I'm trying to think how many years. But I worked intelligence first, and then I think like everybody else got hurt and got physical therapy, and then became a physical therapist for the Army. Done a few deployments overseas as a physical therapist, and have really gotten to see that skill set and problem solving mindset that physical therapists bring to those more austere environments. Physical therapists are used a little bit differently in the military than they are in civilian life, and so practicing in a place that is basically void of what you would normally have in a clinic is pretty commonplace in the deployed environment for the physical therapist. So that problem solving skill, and then the ability to transition to more emergent care when that time came, that was incredibly interesting and exciting to me. And so when I met and saw Paul and learned of his interest, and then heard of the incredible things that Darin Jernigan has done, just that passion and that idea of, hey, physical therapists can really be value added out in the wilderness, that just became a common dream of ours, and we're so excited, I think, to have partnered with ISU and the great team there to to bring kind of this idea of teaching teaching physical therapists to be value added in the wilderness, make that dream a reality. And what better place to do it than at Idaho State? Because just think about the wilderness that's around there, and the beautiful setting, and the incredible team there. So again, just honored to be here, and excited to meet and learn from a lot of other people. Thank you all.
Darren,
DJ, I'll turn it over to you,
Yeah.
buddy.
yeah.
Yeah. Darren Jay's actually on campus here at Idaho State University. So he is the person we've worked most closely with. Darren, would you take a minute to tell us a little bit about why you've developed this wilderness PT program and how it can benefit physical therapists and physical therapy assistants who are already practicing?
You bet. I'll do my best. Just going back to the conversation that Paul started when he posed this question of of physical therapists in the wilderness, and he wrote a really excellent article that ended up in our national magazine and journal. And I was so taken by it, I literally reached out to him as soon as I read it. And that was that 3 years ago, roughly. And so we've been intertwined together for that period of time. My own personal experience is well, when I made contact with Paul, I was like, Paul, I've actually been a wilderness physical therapist for a long time. I combined my skills a long time ago when I became a Jenny Lake climbing ranger, and that entails being an EMS, or an emergency medical personnel that goes out and helps people in Grand Teton National Park and really austere places, from the tip of the Grand to the shores of Jenny Lake. And I spent 20 years doing that. And I have a lot of other experiences in the outdoors because I love to climb and explore and things like that. And so anyway, it was I had years ago been lucky enough to combine my passion of helping people as a physical therapist and my passion of the outdoors and just exploring things. And so it's been kind of, I think, in many respects, the foundation kind of what we're operating off of, especially in light of the model that the military uses, using physical therapists as a point of care healthcare provider, and this value added person on or in an organization or on a team. And so just a couple of things. So I was a Jenny Lake Ranger, which there's a cadre of men and women that are part of this team, and their sole mission really is to give information about the backcountry to visitors of Grand Teton National Park, and also to serve as search and rescue personnel in case things go wrong. And so that's really the premise in which I gained my experience over 20 years, and have tried to bring it to this particular endeavor and integrate it into concepts that Darren Hearn and Paul, who are both post-military, not post, because Darren's still in the military, but Paul was in the military. And so that spawned this 3-year evolution of creating this opportunity for people to get information and knowledge based on our experiences, and then be able to gain the tools to be able to go out and make physical therapy and their love of the outdoors a reality in making something new in physical therapy. So that's my, sorry, I didn't mean to ramble, but that's my story. And yeah.
No, I
Thanks
think
for
that's
letting me share.
amazing. It's been amazing for us to be able to be a part of this and to watch it grow. Had no idea 3 years ago when the Beatties and Darren Hearn came here that you weren't just all like lifelong buddies, right? But you had this same focus and dream to be able to bring this to fruition, and it's been fun to see that roll out. Very rewarding. But I had a question. How common is this PT wilderness training? Is it something that's found all over the United States, or is this pretty unique?
Let me start on that, then I'll ask everyone else to come in. To my knowledge, we're the only people doing this. There are several papers in the literature, but we're actually authors of all of them, or involved with people who are the authors of these papers. So it's really a brand new thing, with the exception, of course, of the military, as Darren mentioned before, where this is the model that we're basing the civilian aspect on. So the military PTs, this has been their bread and butter for many, many years in forward areas and deployment and things like that. Whereas we're now creating this based on a need that we perceive, but also on our passion, as I mentioned. So we're looking at starting off by trying to educate people to be able to be value-added, safe, contributory members of backcountry teams, which requires taking your already doctoral level skills as a PT or your skills as a PT assistant, and then combining that with emergency medical skills that you would acquire. Because if you're out there and something goes wrong and you call 911, you are 911. And you need to be able to handle things for that time. And then concurrent with that will also be a lot of instruction and things on backcountry survival techniques, ethics, leave no trace procedures, things like that, so that you can go in the backcountry, be safe, be respectful of the environment, and make things better. And so our curriculum is really based on those three principles of using your current scope of practice, therapy skills, upgrading your skills as a first responder medical person, and then being able to go back into different environments, be they mountain environment, whitewater rafting, backcountry hikes, wildfire assisting, and on it goes. And so that's kind of the thing. Again, to our knowledge, we're the only folks doing this right now. We're real excited. We've given some talks at national conferences that have been really well attended and well received, and we'll be presenting next month at a virtual conference in California that should be a real big thing that should go a long way towards spreading this idea. They have an international audience, and we're real excited about that. Anyway, DH, do you have some things to add to that?
No, I think you summed it up really well, Paul. I would just say I think that the uniqueness is what will draw a lot of folks and a lot of interest, because it's so many of people in our profession are just innately drawn to being outside and being active, and so I think it's just it's a really cool way to combine what you like to do and what you do for work, so that you like what you do for work.
Yeah,
That's very true. We've had physical therapists from around the country reach out to us, starting with that paper in the APTA magazine, The Emergent Role of Physical Therapy in the Backcountry. Starting with that, to the presentations that we've given, to the in-person conference that we did a couple of years ago. I think it was in the fall in Colorado with their state meeting there. And it was just really well received. And, you know, as Darren said, physical therapists as a whole, not all, but really do love to have adventures and spend time outside. And I think that's kind of just really an essential attribute to somebody who would explore the field of wilderness physical therapy. And that's kind of who we're catering to, because like you mentioned, Raelyn, we just kind of recently met DJ recently in the term of the grand scheme of things, maybe 3 years ago. And we feel like we are, you know, great friends and so much in common. And the people that we've met in our in-person courses and who've contacted us online and we've communicated with, we feel that same sense of passion and connectedness, if you will, to want to explore this area, and as PTs to learn how to then learn the wilderness skills to practice outside and help respond to emergency situations. So it's super exciting. Yeah.
We had we did a course in Colorado, in Breckenridge, Colorado, 2 falls ago, and we had 20 participants, and it was magic. I mean,
Yeah,
it was
that's
just
so awesome.
we got people together, and it was really good because it was across the professional spectrum. We had new career folks, we had mid-career folks, we had some older folks, and everybody, the vibe and the fellowship and everything was phenomenal. And we got together, we got out, and it was hot, and then it snowed, and so I mean, it was like perfect, right? And we just had this wonderful time, and everybody was buzzing, about it. And so that was a big motivator to move forward, in that there are a group of people, as Karen was saying, across the world, because we have some international folks, particularly in Europe and also in Australia, that love this kind of stuff and are really interested too. So I think that this will meet that market need. It should be great.
Awesome. So maybe can you share an example of maybe where you've seen PT kind of combining with that search and rescue or wilderness medicine that has been particularly important to that person and in the care of that person?
DJ.
I think we all have stories, but DJ for sure.
DJ's got several volumes.
Well, I mean,
and
Darren
has
Hearn,
some too.
Darren Hearn
Just-
could
yeah.
also, give all kinds of examples as a PT that's operating in an austere environment on a military mission, right? But to speak to that particular question, and it goes back to just, I was an accidental wilderness physical therapist because I became an EMT person and I was already a physical therapist. So I didn't realize that, well, I did eventually, that I was going to be this thing that we're actually trying to help people to become. But, over the span of 20 years, I did rescue missions in Alaska, Colorado, Idaho, Wyoming, Montana, so all over the place. And on any given EMS intervention that I participated in, I integrated all kinds of different scopes of practice that, from that, just like Paul said, the doctoral level physical therapy lens, incorporated with my EMT skills. And so that many times, maybe it was just assessing someone that had, let's say, some sort of trip, slip, or fall, and maybe they had a sprained ankle, maybe they had a fractured ankle, but being able to more thoroughly evaluate someone, potentially splint someone with tape or unweighting to get them, to safety. And so there's lots of different times. That's one kind of broad kind of example, but other are things like using my hands-on skills to reduce a shoulder dislocation. And I'm going to say we can actually do that as a wilderness first aid person or a wilderness first responder or a wilderness EMT, but using my hands-on skills where, we work with people with a lot of musculoskeletal injuries to be as sensitive to that process as possible. That's just a level higher based on our anatomy and physiology. And so just imagine someone that has low back pain and they're on some sort of backcountry trip, and how to manage their low back pain to get them maybe so they can continue their trip or get them to safety. And so you can start to see, like, am I on a river trip? Am I on a mountaineering trip or whatever? The physical therapist is going to be able to employ these advanced skills that other folks would not possess. because they don't have a license to be a physical therapist, and treat
Right.
people as a physical therapist wherever you find yourself. And so I don't know if that answers it, Raelyn, but
No,
that's,
it does. It
does
does.
it?
I
Yeah.
think that's perfect because I think you add something to an additional
Yeah.
scope of practice and additional knowledge that really help. I know Darren Hearn had mentioned something in one of our conversations too about some time that he spent on with the wildlife fires and some experiences that he had there. Can you share something about that, Darren, and how that was really beneficial to the people that you helped to treat, what that meant to them?
Yeah, sure. Then it's full transparency. When I served on with Wild and Fire, it's been as an EMT, but I think it's the knowledge base that you bring to DJ's point. So even though my treatments are in line with what an EMT treatment would be versus technically a physical therapist, it's the understanding like how powerful putting your hands on someone is and assessing them, but not only that, then moving them or getting them to move and be comfortable with moving. It what that allows you to do is when you're treating in the austere environment is to really take something that in the person's or the injured or the hurt person's mind may be completely limiting. Like in their minds, they may not be able to go any further. They need to be removed from the situation, but just your skill, your hands-on touch, and your ability to evaluate and then present the results of your evaluation to the patient in a way that they can understand it. That skill set that the PT brings and that in our training brings helps de-escalate that situation in the hurt person's mind too, which allows them then to move and allows the situation to go from being emergent where that person has to be removed to something that where they may not be able to stay and play, but they may be able to walk out versus be removed from the situation in a much more costly manner. So that I think that's the skill that we bring, whether it's to fire, Jenny Lake, any austere environment, the military. It's that certainly we have those skills to do joint reductions, splinting, assessing, but we also understand how to talk to the patient and get them to move safely within the limitations of their injury. But I think that's an important piece of what we bring there.
Yeah, that's perfect. That's
Let me give a good example on that. Quickly, and then Karen wants to say something too. But
okay.
To illustrate that, about a year ago, we were on backcountry patrol, around Jenny Lake in Wyoming at the Van Teton National Park, and there's a sort of a narrow trail that goes up the side of this cliff. It's called Inspiration Point, and a lot of people go up there. It's beautiful. And there was a middle-aged couple that were at the top, and the woman was panicking and was having a hard time going down. And basically that happens to all of us at some point, and she had just simply couldn't go, and she was stuck kind of in the middle of the trail, and it was a problem. She was embarrassed and also scared out of her wits. So we went up, and that's where we put on our PT gait training hat. And it was kind of like getting somebody out of bed in intensive care when they're having the worst day of their life and they don't want to get up, but they got to get up, and sort of that behavior that you would have to, be in their corner and to support them, but at the same time, get them to do it. And so we basically just got into our gait training mode, and we're able to take her down the hill one step at a time. And then as we got closer, you could see her confidence build. And then we got to the bottom. It was a great story. And again, it was nothing, it wasn't like a life-saving thing or anything, but it was using that PT specific skill, just like you would in a hospital environment, to basically empower someone who's having a hard time. Yeah.
Well, I was just thinking about that too. When you asked, for example, that was the basic rudimentary one that came into my mind too, because we basically walked her down the hill or gait trained her down the hill. But mind you, this is a steep hill with a significant drop off, and she was in a panic mode. And you said that it wasn't all that, but it really was, because like Darren Hearn referred to, like if we weren't there to help, I think somebody, a bystander, probably would have called that in to the rescue cache or called the Teton dispatch, because she wasn't going to make it down alone. And so there we were using our, skills that we're just real confident with, and felt confident in that environment to get her down. So that, again, just a foundational thing that we as PTs do. And, we could spend the next, hour or so just on that hill and right above that into Cascade Canyon on things that we've come across that we're able to help people, through our experience as a PT, and just, feeling comfortable after getting permission to, put hands on them and go from there in an evaluation, or maybe just breathe with them, have them breathe with us, because they're a little bit, at elevation, and they just need to slow down their breath, and then, guide them what's next. And so that's, I'm sorry to repeat the same story, but I just think that it was a good illustration of how PTs and PT assistants can really help to somebody walk out safely.
Absolutely. And maybe they weren't dangling off the side of a cliff at that point in time, but they could have been, like, had they not been able, sure footage, and
Yeah.
definitely emotionally it helped them. So that's perfect. That's really great.
And it was so rewarding when we got down, because, that's what they said, is like, wow, we had our personal PT escort down the mountain, and then it was all, it like Paul said, she was then confident that she could make it then the rest of the way through the flat part of the trail. So yeah, good story.
Perfect.
Well, thank you all for being here. We're running a little bit short on time. Is there someone, before I wrap up, one of you guys that can just give a brief overview of what this course will entail and what people who are taking the course will learn?
We can handle that. Basically, what we have is we have the online modules through CEWT. Right now we have our first module, which is a 6-hour course. Sorry, 5-hour course. 6 hours, excuse me, for 0.6 CEUs. And this is an overview called Introduction to Wilderness Physical Therapy, and it covers a lot of the basic things in terms of scene safety and primary, secondary exam, how to take a history in the backcountry, and evacuation. The second module will be coming out, and that's going to be 0.5 CEUs. And that is on environmental effects on the body. And that includes hypothermia, it includes heat illness, altitude illness, and several other areas, including animal encounters that people would need in the backcountry. That should be available in about 5 weeks, hopefully. The third module would come out, that's a 0.6, and that's going to be on trauma care. And that will talk about fractures and dislocations and contusions and blunt trauma, and a long list of those types of things. And then our final online module will be on medical conditions. And that'll include anaphylaxis and backcountry cardiac emergencies, pulmonary emergencies, and so on. Our hope is that we'll be able to also offer an online course, hopefully this year. An in-person course, sorry, my bad. Hopefully in August, and hopefully this will be in Pocatello. We're looking at some options right now, and that could be a really exciting moment. And the objective of our first course is to have people achieve a wilderness first responder certification that they would get upon completion of the entire package, which we hope will be available by this summer. So that's where we're going.
Yeah, I love it.
Yeah, I know. And then the second level is still in the planning stage, and that will be more survival stuff. And then from there, yes.
Yeah, I think another important thing to note about this first course. So right now we have module 1 online, and then as Paul said, the rest will be coming, and the in-person will be coming as well. And they all can be taken as a unit, but also separately. So actually that's how you would take them. each one independent of the other, and earn physical therapists, North Carolina APTA approved CEUs along the way. So the total packet, when it's all together, you will have earned, if you've taken every course, you will have earned 40 contact hours or 4 APTA NC approved CEUs. So again, you could take if you've just joined us and we're posting on the in-person is coming up, you could start with that if that's where you're at. And then if you wanted the complete wilderness first responder physical therapy certification, then you would, go back and take the other one. So it's a nice kind of setup, and that's also how we're able to release it is in the modules. But, just know that you don't have to take the entire thing. You can just join us for this first one and see how it goes and explore from there.
That's perfect. I love it.
Thank you all. If you would like
Thank
more
you.
information for the wilderness physical therapy course we have, you can see that on cetrain.isu.edu. That first module is priced very affordably at $149. It should be up and ready to go shortly. We've just got some beta testing we're finishing up, and the other modules will follow. You will see that in our spring catalog. If you're an alumni, you likely will get an email from me as well. So go ahead again, that's cetrain.isu.edu. You can find all our contact information there as well. If you like this type of content, please like, share, comment. That helps support our channel. And thank you so much to Raelyn and our guests. We look forward to seeing you in our PT Wilderness Physical Therapy courses, and stay safe out there.